In this presentation, we will be looking at the power of nutrition to prevent disease. Of the 15 leading causes of death in the United States, 5 are nutrition related. Those include heart disease, cancers, strokes, diabetes mellitus, and hypertension, to be abbreviated HBP for high blood pressure. As we take a look at genetics and lifestyle choices, we need to keep in mind that the amount of influence that nutrition has on disease varies, as well as genetic background and the influence of that on disease varies. And it depends on the type of disease that we're speaking of. We usually like to look at this on a continuum, which I will show you in a moment. Lifestyle habits, there are 2 that are more influential to disease than nutrition: smoking or any type of tobacco use. In my clinical work, as I worked in the hospital field, usually if we saw someone admitted with lung cancer, we could trace back into their history somewhere some sort of history of smoking. Excessive drinking of alcohol is the second lifestyle factor that is more influential to disease than nutrition. Now here's that continuum that I was discussing with you earlier. On this left-hand side, we have diseases that are not brought on by any type of nutritional deficiency. They're genetically related. Something like sickle cell anemia. Nutrition has a relationship in that we might be able to give someone certain dietary components to help improve their outcomes of that disease, but we can't prevent them from getting sickle cell anemia with better nutrition. On the other hand, we look over on the right-hand side, this blue side where it says more nutrition related. Something like iron deficiency anemia is an example of one of the diseases here that are purely nutrition related. They're brought on by poor nutritional intake. And nutrition has everything to do with curing that person from that disease and removing it. In the middle here, you have those in-between chronic types of diseases like diabetes and heart disease and cancers that there's a mix of influence. Our genetics, whether our mother or father had those diseases, influences whether we'll get those ourselves. But also our nutrition and our lifestyle clearly can change our fate or our destination on whether we're going to get those diseases as well. Keep in mind all of these details as you read through the chapter and think about your life.